So Kim, kind of back up a little bit. So how did this story get all started? Because I just started seeing your post earlier this week. Kind of give the audience here a little bit of backstory on the origins
Sure.
of this relief effort.
So it actually all started during the week of FMX and prior to FMX when Harvey hit Houston. So when Harvey hit Houston, the Physician Moms and Family Medicine group, which I lead and started about a year and a half ago, we now have about 2,007 or 800 members, close to 3,000 members, physician moms and women who are family physicians from around the world came together, and we had a shirt drive, and we raised money and funds for hurricane relief for Harvey. And during that time, I met a physician who was involved with BREAC225.org, Stacy Benson, who's a family physician, who was furiously raising money for funds and supplies for Harvey and also eventually Irma, and then now for Maria. And so as this whole past few weeks have gone on, we've thought, and the Puerto Rico Academy is so close to my heart, with 17 years of going to the Congress of Delegates every year, and those first few years when the Puerto Rico Academy used to have their own reception at our Congress of Delegates. And they were the first people to teach me to really salsa, and dance, and invited me to the island, and I got to stay there and really get to know some of the physicians in the academy. And so when Maria hit, it just broke my heart to see the devastation. We had just been there a year or two before, and to see the devastation and to know that, wow, I know what it's like when we had no power for 1 week in Michigan. I was doing like pap smears by, flashlight, and we had candles in the office trying to see patients, and it was insane. And I can't imagine what that must be like for months, for 4 to 6 months. And so I contacted several of our friends in the Puerto Rico Academy, Marina and Louise Perez-Thoreau and Leslie Hoy and Jorge Mew, and some of the delegates and offices of the Puerto Rico Academy. I contacted them directly and asked, how are you? Are you out of the country? Are you out of Puerto Rico? Are you off the island? And or where are you? Are you staying? And to hear their stories and realize that we have so many physicians there who have no power, who have no access to clean water, or for the ones that do, their extreme working conditions where they have to drive so far to get to work, was so tremendous that I thought, well, we've got to do something. And so initially it was just trying to connect people. So to connect the Puerto Rico Academy for the Physicians with Ashley Saucier, with the Baton Rouge Coalition, Physician Relief, and with all the different Facebook groups. And so there's where social media comes in, right? The power of social media, where we see how we can connect people from around the world, and specifically from Puerto Rico to Baton Rouge, to Texas, to New York, to Florida, to all the different places now, Connecticut, all the different parts of the country that have come together to help the physicians and communities in Puerto Rico. And when you hear the stories that come back, when you see the joy of people who receive water, we've got photographs of, and I can show pictures of communities where they're getting water, and you think, wow, we take things so much for granted, right? So right now, I decided we're going to try and get generators for our physicians so that they can open their clinics. We would love to have extra money so that we can get satellite phones as well, because many of our physicians are in areas, even the Puerto Rico Academy of Family Physicians does not have electricity at their office. So if we can get the office up and running, that would be fantastic. And for many of the physicians in the academy who are on the board, they're actually at the convention center. They're working with the Ministry of Health. They are coordinating the efforts for the whole area and for the whole island and all the different municipalities. And so we need to help. There are brothers and sisters in family medicine, and we really need to help them.